There's no doubt, everybody in the room agrees, it's better to use long-term systems. We know that we can't always use them, that sometimes there's a need for an immediate humanitarian response that can't go through those long-term systems at that first moment, but ensuring from the very outset that any humanitarian response connects to those systems should be done. First case, best case scenario, use the system that's there. As part of that, a responsibility of governments and of development actors is to ensure that those systems are flexible, adaptable, and able to respond when an emergency occurs. And when you come in as a humanitarian actor, it's often about saving lives. But our interests, the interests of all of us in development, of governments, of all of the different actors involved, are making sure that people's lives are better in the long term, that they have opportunities. So if you do that from the start, you're going to have much more of the impact that you intended to. And that was part of what we were discussing here. Some of the lessons that have been learned and that came out along the way, one of them was sort of a lesson of what we don't know. There is a huge amount of evidence about the impact of social protection. There is less evidence about its specific impact and what works best in contexts of crisis and displacement. So that was, that we need more evidence was of what works, of what specific areas work, and that we need to share that knowledge. That came out quite strongly. One of the other important consensus points is that social protection does not equal cash. It's not cash alone. That other services are always important in social protection, and this is at least as much the case in these complex emergencies. People also need services. They need assistance in connecting to those services. So just having cash isn't necessarily enough. The need for coordination between the different actors involved, in particular, the need for a conversation across development and humanitarian actors came out very strongly. In the what's missing department, we all still suffer from the fact that development and humanitarian architectures are quite separate. How to make those talk to each other, how to talk about and how to support long-term social protection, which is seen as a development response in a humanitarian context. We lack some of the instruments to do that. So that's another area where we need to work together.
You know, to provide cash and allow populations to make their own choices means they participate in the local economy, mean they integrate with the local economy. To set up a social protection system or build on an existing social protection system that's already benefiting host communities and making sure that you're not just taking care either of the host community or of the conflict-affected or disaster-affected population, but doing both mean they have something in common and something shared. And indeed, to ensure or to encourage that the provision of services depends on local service providers and integrates into the services that exist already, again creates a point of contact between the population that's been affected by the disaster and the host community. So for all these reasons, what you have then is easier integration, greater dialogue, greater understanding. And that's clearly one of the positive reasons why this approach is promoted and is successful where applied well. Among the social protection measures that are important to put in place, in addition to the use of cash and the transfer of cash, are measures such as access to health, whether that's removing barriers to accessing existing local health services, or allowing displaced population, as in the case of Thailand, to access the existing health insurance scheme, removing fees to accessing basic education or public school. These are among the measures that should be complementary. When social protection measures are in place, they're particularly important for children. You know, evidence is that whether it's a family that is poor, has been displaced by conflict or natural disaster, a social protection system that combines cash transfers, access to health services, removal of fees, and access to education means that a child is more likely to be in school and less likely to be at work, means that a child is likely to live in a family that's stable and has access to resources to sustain itself, means that a child is less likely to be exposed to violence or put themselves in situations that increase the likelihood that they will be exposed to violence.
In terms of cash transfers, WFP is a fairly significant actor now within the narrow world of humanitarian sector. This year we're on track to do more than $1 billion of transfers to vulnerable people. How we do those transfers will shape whether or not we're having longer term productive sort of results or not. And so very much the kinds of things our colleagues are talking about, who you actually target, the conditions by which you reach them, whether you do or don't engage them through an education center or a health center or a social welfare center or some other mechanism, how you actually engage them, whether or not you have the systems in place to monitor the results that are being achieved by putting the additional purchasing power in their hands, whether you have sort of appropriate information, counseling services around that. All of these things are what make a difference to whether the cash itself achieves the fundamental objectives for addressing their vulnerability. So there's a lot of excellent policy work being done. There's a lot of excellent institutional building that's being done. But fundamentally, there have to be systems in place, and these have to be country systems in place. As the financial sector improves, as the technology sector improves, the possibilities to do digital things and the possibility to manage information, to engage fintech, all of these things are really strongly emerging, and that's where WFP, largely driven initially by our humanitarian response, but now recognizing the system building possibilities of this, that's very much where we're heavily engaged right now in the countries where we work.